This is the news in brief from the United Nations. The identification of a fast-spreading HIV variant has highlighted the importance of stepping up action to halt the HIV pandemic and reach everyone with testing and treatment. That's according to UNAIDS, which is leading the global fight to end HIV and AIDS. The agency made the appeal on Monday, citing newly published research from the Netherlands about a more transmissible and damaging variant of HIV, which has been circulating in the country for years and remains receptive to treatment. UNAIDS said while the variant does not represent a major public health threat, it underscores the urgency of speeding up efforts as roughly 10 million people worldwide living with HIV are still not on antiretroviral therapy. Eamon Murphy, the agency's acting deputy executive director, said, "We urgently need to deploy cutting-edge medical innovations in ways that reach the communities most in need." He added that whether it's HIV treatment or COVID-19 vaccines, inequalities in access are perpetuating pandemics in ways that harm us all. Strengthened UN regulation on emergency braking for trucks and coaches is expected to further increase safety on the road, the organization's regional office for Europe said on Monday. UN Regulation No. 131, adopted nearly a decade ago, made it compulsory in the European Union, the EU, for new trucks and coaches to use an Advanced Emergency Braking System, or AEBS. Last month, a working party adopted new draft provisions under the regulation outlining stronger automated braking even if the driver was not alerted beforehand by a warning system. If adopted by the World Forum on the Harmonization of Vehicle Regulations this June, the revised regulation would enter into force by February 2023. The new measures build on experience gained with AEBS in recent years and should significantly reduce accidents and fatalities occurring in traffic jams. They will also restrict conditions under which emergency braking assistance systems can be switched off. Systems will have to be automatically reactivated after 15 minutes, basically meaning they will be activated almost permanently. And finally, an agreement between the World Health Organization, WHO, and the Commonwealth aims to strengthen collaboration to address the COVID-19 pandemic, vaccine equity, advancing universal health coverage, and building resilient health systems. WHO Chief Tedros Adhanom Ghebreyesus and Patricia Scotland, the British Baroness who heads the 54-member Commonwealth group of countries, signed the Memorandum of Understanding, or MOU, on Monday in Geneva. It covers 7 priority areas, which include strengthening global health security, promoting the health of vulnerable groups, building a data partnership, and creating space for innovation and exchange of knowledge. Commonwealth countries have a combined population of 2.5 billion, more than 60% of whom are under the age of 29. So far, more than 77 million COVID-19 cases have been reported in Commonwealth nations. Overall, some 42% of citizens are fully vaccinated. Deanne Penn, UN News.
This is the news in brief from the United Nations. 13 million people across Ethiopia, Kenya and Somalia will face severe hunger in the first 3 months of the year, the World Food Programme warned on Tuesday. 3 failed rainy seasons have decimated crops and led to major livestock deaths, and forecasts say rainfall is likely to remain below average. According to the UN Children's Fund, the needs are massive and urgent, and they are quickly outpacing the funds available. The UN agency projects that up to 20 million people in Eritrea, Ethiopia, Kenya and Somalia will need water and food assistance in the next 6 months, and many of them are children. Right now, nearly 5.5 million children are threatened by acute malnutrition. People's sense of safety and well-being is at a low in almost every country, with 6 in 7 worldwide plagued by feelings of insecurity. That is according to new data from the UN Development Programme, showing that even citizens living in countries that enjoy some of the highest levels of good health, wealth and education outcomes are reporting greater anxiety than a decade ago. The report calls for more solidarity across borders to tackle the disconnect between development and perceived security. Wednesday also marks Safer Internet Day. According to the International Telecommunication Union, 1/3 1/3 of all internet users are children under 18, and a child goes online for the first time every half second. Young people also spend more time online than the rest of the population. In 2020, they were 24% more likely to connect to the internet. An estimated 71% of those aged between 15 and 24 use the internet, compared to just 57% in other age groups. In a survey run by the agency, cyberbullying came out as the top concern, with around 40% saying it was an issue. Participants also raised alarm over data protection lapses and the threat of grooming, where abusers exploit children online. Alexandre Soares, UN News.
This is the news in brief from the United Nations. World leaders on Wednesday launched a campaign to meet a $16 billion funding gap for the Global Health Initiative to end the COVID-19 pandemic by the end of this year. By funding the Access to COVID-19 Tools, or ACT Accelerator, coronavirus diagnostics, treatment, and vaccines can be equitably provided to all people globally, regardless of their wealth. Secretary General Antonio Guterres described vaccine inequity as the biggest moral failure of our time. He said that if we want to ensure vaccines for everyone, we must first inject fairness into the system. The ACT Accelerator Initiative is a partnership of leading agencies that works to overcome global inequalities by offering low and middle-income countries access to tests, treatments, vaccines, and protective gear. World Health Organization Chief Tedros Adhanom Ghebreyesus noted that science had provided the tools to beat the pandemic, and if they are universally shared in solidarity, the global health emergency can end this year. Artificial intelligence, or AI technologies, have the potential to revolutionize public health and medicine for older people, but only if ageism is eliminated from their design, implementation, and use, WHO said in a newly released report. The World Health Organization's Ageism in Artificial Intelligence for Health presents legal, non-legal, and technical measures to minimize the risk of neglecting the needs of older people. WHO's Alana Officer said that the new report shows how to identify and eliminate ageism from AI design, development, use, and evaluation. It also outlines strategies, such as investing in digital literacy for older people and their healthcare providers, as well as age-inclusive data collection for caregivers. Turning to peace and security, UN counterterrorism chief Vladimir Voronkov told the Security Council on Wednesday that the ISIL terrorist group is on the rise again. He said that the group, known in Arabic as Daesh, continues to move and operate across unprotected borders, while regional affiliates may have gained new capabilities. Despite the COVID-19 pandemic, Mr. Voronkov said it was crucial for states to remain focused and united to counter the scourge. As people, especially youth, spend more time at home and online, he explained that ISIL propaganda and incitement has continued to grow. He warned that this could lead to a sudden rash of attacks in some countries when pandemic restrictions ease. To stem the group's resurgence, he underscored the need to disrupt new attacks, tackle the threat of regional affiliates, and solve the protracted issue of their family members in displacement camps and detention facilities across Syria and Iraq. Liz Scafidi, UN News.
This is the news in brief from the United Nations. There's finally light at the end of the tunnel in Africa's battle against COVID-19, said the World Health Organization's top official on the continent on Thursday. Matshidiso Moeti said though more than 11 million cases had been reported since the pandemic began 2 years ago and 245,000 lives lost, as long as we remain vigilant, the continent is on track for controlling the pandemic. She said Africa's long history and experience with large disease outbreaks and accumulated expertise had seen the response become more effective with each new wave. Despite the encouraging trend, the pandemic has taken a brutal toll, she said, including on the economy. The World Bank estimates that 40 million more Africans have been pushed into poverty due to COVID-19. In his message for the International Day of Women and Girls in Science on Friday, the UN chief has hit out at the gender inequalities which he says are depriving the world of enormous untapped talent and innovation. Only 1 in 3 science and engineering researchers in the world is a woman, said Secretary General Antonio Guterres, adding that structural and societal barriers are preventing women and girls from advancing in the field. We can and must take action, he said, calling for targeted measures to give women opportunities to grow and take a lead at institutions and labs worldwide. And finally, an encouraging new development that will improve the lives of breast cancer sufferers living in the Amazon basin. From this year, they'll have increased access to screening thanks to 2 new mammography units installed on Brazilian Navy ships, delivering services along the vital South American waterway. They've been supplied by the International Atomic Energy Agency, IAEA, and the new machines carried on board the ships will treble the current capacity for mammograms in the remote region. In Brazil, breast cancer represents almost 30% of all types of cancer, with approximately 40% of patients only diagnosed at an advanced stage. Matt Wells, UN News.
This is the news in brief from the United Nations. The UN Refugee Agency is stepping up its response to assist hundreds of thousands of internally displaced people in Myanmar. According to the agency, the number of internally displaced people has now grown to 800,000, doubling since February of last year. Across the country, security is rapidly getting worse as fighting and armed conflict intensifies. Forecasting more displacement in the coming weeks and months, UNHCR is now working with partners to scale up operations. Most internally displaced people are dependent on humanitarian support for survival. The 600,000 stateless Rohingya living in Rakhine State also require more help. UN humanitarians are also hard at work in Madagascar, where last weekend a massive storm has now left 92 people dead and affected another 112,000. Cyclone Batsirai struck the island nation only 2 weeks after another deadly storm, Cyclone Ana. UN agencies, including the World Food Programme, have been ramping up response in close coordination with government agencies. In addition to hot meal distributions, the UN Children's Fund and the UN Sexual and Reproductive Health Fund have been boosting protection services. Health partners have sent essential medicine, emergency health and first aid kits, mosquito nets and COVID-19 prevention materials. They have also set up emergency medical posts. In Lebanon, a general election which could end months of gridlock and crisis are due to take place in mid-May. On Friday, the International Support Group for the country met in Beirut. To review the preparations and issued a strong call for free, fair, transparent and inclusive process. The group noted that the international community is deeply committed and has provided significant financial, technical and political support, but it's down to national authorities to manage the election properly. The ISG asked them to intensify preparations to ensure the timeliness and integrity of the process. They also stressed the need to allocate funds and the importance of allowing the full diaspora to vote. Lastly, the group called on all political stakeholders to take every possible step to encourage and ensure the inclusion of women candidates. Alexandre Soares, UN News.